Hello everyone. In this video, I have listed the important points regarding renal pathology which will help during the revisions for exams. So let's get started. Firstly, talking about hypertension, the important clue word for you will be like for benign hypertension, there will be history of hyaline arteriosclerosis. In malignant hypertension, onion skin or flea-bitten kidney will be given, and papillary necrosis is associated with diabetes or analgesic abuse. Now talking about lupus nephritis. The question asked is like which is the most common and severe form, which is the type 4, and it is known as diffuse nephritis. Subendothelial deposits will appear as fingerprint on electron microscopy. Full house effect is seen and wire loop deposits are seen. Now let's talk about IgA nephropathy. IgA nephropathy is associated with celiac disease, and there will be history of respiratory infection less than 1 week. In post-streptococcal glomerulonephritis, respiratory infection will be of 1 to 3 weeks and skin infection more than 3 weeks, and subepithelial deposits will be present. Now let's talk about MPGN. It is of 3 types. Type 1 is anti-GBM associated, type 2 is immune complex associated, and type 3 is ANCA mediated. Crescents will be seen. Next point is regarding nephrotic syndrome. So in nephrotic syndrome, what is present is proteinuria is more than 3.5 grams per day, hypoalbuminemia, and pitting edema will be there, and there will be hypercoagulable state because there is loss of antithrombin 3 and hyperlipidemia is there. So if these features are given, answer will be nephrotic syndrome. Now most common cause of nephrotic syndrome in children is minimal change disease, and it has lipoid nephrosis, and it is associated with Hodgkin's lymphoma. So on electron microscopy, there will be effaced food processes. Now we'll talk about FSGS, focal segmental glomerulosclerosis. It is associated with HIV, sickle cell, and it could be idiopathic also. On immunofluorescence, no granular deposits will be seen, and on electron microscopy, there will be loss of food processes, and it has poor response to steroids, and it is the most common cause of nephrotic syndrome in adults. Now we have membranous nephropathy. It is most common cause of nephrotic syndrome in elderly, and remember it has association with hepatitis B, C and Ca colon. It is very frequently asked. Subepithelial deposits, and there will be spike and dome pattern. Now let's talk about MPGN, that is membranoproliferative glomerulonephritis. It has 2 types, type 1 and type 2. Type 1 is subendothelial deposits and type 2 is dense deposits, and it has low levels of C3. So these were the important points regarding renal pathology. Thank you.